Hi, I'm Catherine Ayers-Wickenhauser, Director of Communications at Direct Trust. And today I'm so excited to be joined by two of our most recent Interop heroes from Arkansas SHARE, Ann Santifer and Justin Ballins. Hi, welcome. Will you two introduce yourselves and tell us more about Arkansas SHARE, please?
Hey, thank you, Catherine. Hi, everyone. I'm Ann Sanifer. I'm the director here of our HIE. It's called SHARE. It's a statewide HIE, and SHARE is uniquely housed under the Arkansas Department of Health. And our main goal really is to reduce the provider burden, not having to submit paper records or submit paper records to the health department.
And I'm Justin Villines. I'm the HIT policy director here at SHARE, the HIE. And just like Ann said, one of our biggest things that we're trying to do for the state is to really work on interoperability, education, working on reducing that burden across all spectrums of health.
Wonderful. And, Ann, you just mentioned reducing provider burden. And I'm curious, maybe could you describe more of the relationship that Arkansas SHARE has with care providers in the state of Arkansas?
Sure. SHARE is well received by the provider community. Back in, when the Affordable Care Act came into play, Arkansas did a couple of things really uniquely. They expanded Medicaid, they created value-based programs to lay on top of that, and they really understood that data was going to be a big part of the strategy. So at that time that Medicaid was being expanded, they also set up, they created an act to create the very first statewide health information exchange right here in Arkansas that was meant to be, a standalone state office to connect providers with one another and reduce that burden on them of having to seek records, and by making their clinical data available to them when they were making those decisions.
Mm-hmm. And to add on to that, really, I think one of the biggest things through that, it's when you're starting something new, especially in Arkansas, it could be overwhelming. And so this has been a process to really bring everyone to where they need to be at a hospital level, at a clinic level, care coordinator, provider level. And through that, it takes steps. It's not a, let's plug in everything and everything works. It's education moments that have to play, and we can touch on that. But I think, as evolution has happened, you have to be able to move and work with those different individuals along the way to have success, whether using your direct trust secure messaging or you're integrating with that EMR system.
Right. All playing back to that, triple A, right? Reducing the provider burden, improving the quality of care of Arkansans, but also reducing that over expenditures. Our patient-centered medical home program has been super popular here. Most primary care physicians take advantage of that, and having a good HIE interaction and integration is a key to their success. So we're fortunate that we have been well received, not by all, but by most.
Yeah. And I think that one of the big things too, and we are really happy about using direct trust secure messaging across with our reports. Like Ann said, our patient-centered medical home model of care used with the Arkansas Medicaid, which, about 1/3 of Arkansans are on Arkansas Medicaid. So it's a large population, and we're notifying and pushing alerts and reports out to the providers when they need it. And I think, even though we're a value-based program under Medicaid or some of the other private pay, it's really key to understand that the infrastructure is there. It's just about really utilizing the processes in place and then pushing that out, not just in one community, but really using that one community and continuing to build on those communities till it's more of a statewide effort. And that's what we're really lucky to be, that statewide HIE, to be able to push that at all four corners of the state.
And that's incredible. Justin, you just hit on something too that I'd like to dig into a little bit more. You just mentioned the infrastructure is there. And now I'm kind of putting words in your mouth, but it's about the education piece too, and them knowing what's there. And so this is something that I think has been such a hot topic in interoperability recently. For so long we were focused on the technical infrastructure and let's build it. And if we build it, they will come kind of an approach. But now it's almost like the conversation is about we need to double down on education. And I think you all have some specific thoughts on that too. You have a certain approach that you take to education. So could you outline that a little bit more for the listeners today?
Sure. Well, we today have Justin. He's our workflow, expert here at Share, and Justin does a really great job of whenever we bring someone on live. He really works with those practices to incorporate the data, the tools that we provide to providers into their daily workflow. So, pre-pandemic, we were visiting with, large groups of care coordinators or with practices, sitting down with them and really hashing it out. What's your workflow? Great. Now that we know how that works, this is how we can incorporate the data. And Justin, I don't know if you want to talk a little bit more about the great work you've done with the clinics out there.
Well, I think that, prior to the pandemic, it was really easy to go, I call it boots on ground, go into the hospital, go into the clinic and being able to work for them. So now that we're still in the pandemic, you have to really realize, okay, we're using Zoom, we're using GoToMeeting. We have to engage those individuals. So I think it's more of a team effort, really working at the HIE so that your data team is talking to operations, your technical team is working together. When you find a need up there because you are not face-to-face, and Arkansans love face-to-face, shaking your hand and saying, hey, this is the way that we're gonna, how we're doing things. So you gotta be able to figure out different other mechanisms to make that work. And so we really depend, everyone within the HIE understanding, the customers out there, knocking, and saying, hey, can you reach out to this one, et cetera. But once we identify what services that they're going to need, whether it's using direct secure messaging, whether that's our reports, the hospital's using our XDR connections with direct, then we figure out, okay, what's the best method? And then training all of that staff. But training once is not the end all be all. We have to continuously train, and we have an open forum in our operations. We have education that anyone can sign up for on Tuesdays and Thursdays or ad hoc. And we have found, especially with turnover within hospital, big health systems, small little practices, that they are continuously needing to understand how the health information exchange works. You would think that, we would run out of those healthcare professionals because they're going from one entity to the next. But I can tell you over the years that you meet new individuals that have no idea what an HIE is, what SHARE is when they come into a new organization. So really, you have to go back to the drawing board and really go from building that foundation all the way up. And I think that is really key to success for any health information exchange or any organization, because if you're bringing them and treating them, not that, hey, you should know this, it's, hey, these are the tools in which that you can be successful in using the HIE, and this is the workflow in doing that. They are more apt to use that on their day-to-day workflow, and then everyone is succeeding. And I always circle back that it's about the patient. So we're assisting that patient in their needs and creating those pipelines so that wherever a patient may go, they have that information where they need it.
Yeah. The open bridges have been really popular. You don't have to think about it ahead of time. You can just hop on in during those open calls and get the help of, maybe you forgot where a button is or you forgot where something is, and you can just jump right in and get the help that you need. But, the staff is always available too. We have one person on staff who's completely dedicated to training. So she trains somebody before they go live. She, hosts all the open bridges, and then she does ad hoc training too. And then Justin comes in really to help more kind of an upper level management with workflow analysis and incorporating the tools. So I think having a combination of that plus, written materials that folks can refer back to it. A lot of times we even go a little bit above our scope. We recognize that a lot of EMR vendors don't spend a lot of time training their providers on how to say query the HIE, going after those external documents. And that's really key for clinical decision making. So, we've taken the stance that we reach out to the vendor, we get the screenshots. Hey, we're going to do the training and we're going to make sure that these folks are empowered with the tools that they need to be able to do their work in the most efficient way.
Yeah. And to add just a little bit more onto that, we're value-based heavy within our state. So we have practice coaches that are going out there from the health plans. So if we can empower them with screenshots, with education, when they're working with their providers and the care teams, when in the rural or urban areas of Arkansas, they have the tools that they can be able to supply them when they're face-to-face with them, and they can supply our direct connections, whether it's our phone number, our email, so then they can be able just to send an email, call us, and we're always available. And I think that's really key, just to meet the nurses, the doctors, the health systems where they need to be met, and encourage continued growth on their interoperability, their use of the different services and products that can really impact their whole community.
And I think this is so huge because, we talk about interoperability and it's always evolving, right? There are things and connections happening and it's constantly changing and growing. And yes, the infrastructure is here, but you all have just highlighted this continuous education cycle and that it's not a one and done approach. It is those multiple touch points to really make sure that you're best serving the providers of Arkansas to best serve the patients of Arkansas. So I love that you have placed this emphasis on education. And I think this is a true opportunity. And you pointed out EHR vendors and others. I think people can really learn from this because there is such an opportunity with education. And I love that you all have those open calls where people know that they can join and get that additional education or support. And the multiple levels that you described of assistance is really huge. And even, the people that are empowered out in the community to provide that education as well. That's incredible. I just love that you all are taking such a well-rounded approach to this and really thinking about it's not just that initial training. It goes well above and beyond that. And so I think, just thinking about all of the amazing things that you've done with Arkansas Share, and I know a lot about what Arkansas Share has done from prior conversations with you, but is there anything that you would want to share, things that you're especially proud of that Arkansas Share has done, or things that might be coming in the future that you would want to share with the listeners today?
Oh, I was waiting for Ann to go, but I think one of the big things that I'm excited about, and I'm from Arkansas, and my family's here, and so when I started working in health information exchange, it's like myself, what is interoperability? What is a health information exchange? So, and I think all of Arkansans, including the CEOs, the C-suite, all the way down to that mid-level practitioner. It's like this was the same way. But seeing the growth from one hospital coming on, and it happened to be in a community in which I grew up in. So it was really exciting to kind of see that one hospital and that one health system where we're still assisting them today and orders gateway, being able to assist that community and day-to-day interoperability within that health system in their clinics. But to see that one come on in late 2013, 14, all the way to where we are today, 86 hospitals in Arkansas, opening our branching out for any Arkansan that goes to Tennessee and Mississippi and bringing that information in from other health systems. and over 23 or maybe now 2,400 facilities that are sending data, and then another that are accessing the data. It just excites me to understand the growth, but it does not just happen overnight. You can see that from 14, this is 2022, okay? 1 to 86, one clinic to 2,000 something. So it's you have to put in the work and effort. And I think that you start to see and build that rapport with your community, your practitioners, your health systems, your C-suite, your payers, and all of your partners. You have to look at them as all your partners, including, our direct trust friends, that we're using our direct secure messaging within our vendor platform, all the way to our master patient index, and, just all the different components that come with how interoperability works and how those, I get excited about it. I see that this is the future. Data is the future. We have to understand where our patients, meet them where their needs are, especially if we're moving to value-based care and these different mechanisms. Health information exchange really allows so much robust data that can really impact the overall community, the state, whether it be at the patient level, all the way to really controlling cost or looking at those outcomes.
Yes,
and I know
I was going to say, Justin's been here since, the early days of SHARE. So he's really had a chance to see it grow from inception to now. I'd say, I'm proud of a couple different things. First, I'm proud of our flexibility to be able to adapt to the community needs. The pandemic has really highlighted the need for public health data to be shared back with providers. And hey, we just happen to be part of the Arkansas Department of Health. So it was easy for us to adapt current workflows that we had to accommodate for the pandemic. So, providers were complaining and they're like, we don't know when folks test positive for COVID and they're just showing up. So we started targeted reports to them. They wanted to know, well, how do I reach those that haven't been vaccinated? Well, we can create you a report, and include the phone number, and you can just take that one piece of paper and, just start talking to folks and educating folks around vaccine hesitation. We are here in the South, so we do have a little bit of that. I think, we try to take a very careful approach, and maybe that's why we're so well received with the provider community, is because we really try to take an approach of meeting folks where they feel the most comfortable. So if they're not ready to jump on into this whole HIE, it's still kind of a concept to some folks. It's okay. We don't want to force the HIE onto you. We'll meet you where you feel comfortable, because we're confident enough that once you start to get a little taste for that data, you're going to want more, right? And then also, I'm really proud of our relationships. Justin, I don't think there's a CEO, CIO, a care coordinator in Arkansas that doesn't know who he is, because he's talked to them, he's met with them, he's helped them in one way or another. But also, we have great relationships with our Department of Human Services, with our Medicaid agency, with the health plans, the private payers here in Arkansas. They're very supportive of our efforts, to the point where whenever a provider wants to connect and say they have an EMR vendor barrier, there's a cost associated, the payers are willing to open up their checkbooks and support their clinics in sending that data over to the HIE, because they know ultimately at the end of the day, that's one less chart that they have to request from that provider, right? So we're delivering charts now to health plans for risk adjustment, for care gaps, for, HEDIS, for prior authorization. These are all things that used to require a lot of faxing or a lot of phone calls. So if we help those folks better share information with one another, then I feel like we're doing our jobs, right? And if there's an idea out there that folks have, if they have a need, they know they can just call Justin or they can call me and say, hey, what about doing this? And it's not going to be a no. It's always a, well, let me look into it. So I'm really proud of everything we've been able to accomplish, but I think, we've taken some unique steps to be able to make it happen too.
Sure. And, certainly thinking about unique, I think we've barely scratched the surface here of all of the use cases that you support. There are so many. And what you just mentioned of providers coming to you or organizations or entities coming to you and figuring out a way to support it. Certainly Direct Trust has seen that you all have taken those steps to be innovative, to think about the infrastructure that's built and how you can best use it to solve some of those issues like the pandemic that you've highlighted. So I would encourage the listeners today to go back and listen to a prior conversation that we've had where we talked about so many different use cases that you all support. And I really think that that's inspirational, thinking of what's possible using direct secure messaging and then other interoperability components too. So I want to put in that personal plug because I know we may not have time to get into all of that today, and we're kind of coming to the end of our conversation. But with that note, any final thoughts or words of wisdom that you would share with those listening today of how they might find success with interoperability, or any general, I guess, parting words?
Yeah, I would say don't discount simplicity, right? So we can create fancy dashboards and direct providers to log into those and use it. Our philosophy has really been a push approach. And this is where direct comes in, and we have this unique way where we take attribution lists from the health plans and we create targeted reports right back to the providers only on those patients that are attributed to them. So they don't even have to submit anything to the HIE in order to be able to reap the benefit. And, and you just have to fine tune it and make sure you're not overwhelming them with information, overwhelming them with data. So just keep it simple. It's using technology, but, direct has been a really good avenue to be able to push these targeted reports to the providers. They've grown accustomed to it, and we just keep adding use cases to it.
Yeah, and I'll go on to say, I know that our vendor says that we're one of the biggest ones that sends out so many messages, every month. But I think with that simplicity, you also, and I'll circle back around to that education, even though it's simple, you still have to understand and work with them about, okay, something as simple as, okay, download that PDF, print it off, okay, if it's a PDF or an Excel. This is how you can, so don't discount also getting and really meeting them where they need to be met, that LPN, that MD, or that provider, because they may truly not know how to utilize those simplistic reports. But if you can educate them and provide them with just screenshots or just show them how to use it, you're going to set yourself up for success at the HIE level, but also you're setting up that care team, that own clinic or that health system, and then they're going to come back and utilize you more because they know that you're approachable, that you can help them in their need, and that, I don't ever believe, and I don't think any does either, is believe in a silly question, right? I mean, you can come at me with any question and I will repeat it 5 to 10 times, because maybe that 10th time that we go over that workflow or how to use it, you're going to get it. And that is success right there.
Mm-hmm. Yeah, I think that's so tremendous. I mean, obviously a big part of what you all are doing and the value that you provide is in education. And I love that you're highlighting the relationships component of that too, because I think that is such an opportunity for the interoperability and health IT industries, is to really now embrace those relationships even more and embrace education even more. We've built it. We have success. We know it's working. So how can we further drive adoption? And Arkansas Share has been a tremendous testament to that, of the education and the relationships piece. So Anne and Justin, congratulations on being recognized as Interop Heroes, and thank you for the conversation today.
Thanks, Catherine. It's
Thank
always
you
a
so
pleasure.
much.
To watch more Interop Hero spotlights like this, visit directtrust.org/Interop Hero.